Hello, this is Dr. Steele. Today I want to talk to you about a subject that you need to remind yourself because diabetes is a vascular disease. And what I mean by that is that diabetes, the inside, what it affects is your inside your vessels. So please keep in mind that whenever you and I eat, the food needs to go somewhere, right? It goes through your mouth, your esophagus, your stomach, your small intestine, and then from there, it's going to get absorbed in your venous system and it's going to be distributed along your vessels so you can feed all the cells of your body. So, what I'm saying to you is that diabetes is a vascular disease because that sugar, and not only that, those proteins and those fats are not being picked up right away from those vessels. So you have to keep in mind that diabetes is a metabolic disorder, and we know, and we focus more on the sugar, but it's not, or the glucose, but that's not only that. Your fats are not being metabolized correctly. Your proteins either. That's why people lose muscle mass, and you, of course, your sugars, which we know. So the example I can give you, let's say the garbage man doesn't pick up the garbage behind my building, and if it happens long enough, that the back of my building is going to be filled up with garbage, and those cars cannot go through that obstruction. The same can happen to your cells, especially your red cells. If there is no way for the red cell to reach your tissues, in this case, your feet, that can lead to amputation because of the lack of oxygen. If it happens in your eyes, it can lead to blindness, as you already know. If it happens in your kidneys, those cells that filter of your blood, your kidneys, just like your liver and your spleen, they filter different things and they produce different stuff. But in this case, your kidney, then it doesn't work anymore. It is not able to filter your blood anymore. And if it happens in the nerves, that's when people get neuropathy, which means a fancy word, those vessels of your nerves that feed your nerves die. Or if they don't die, they're lacking oxygen and those nerves start crying, tingling, numbness, pain, right? And if it happens in your heart, well, that can lead to a heart attack, right? Because those vessels become obstructed. Again, I'm telling you, diabetes is a vascular disease at the end. And there's more things. I mean, just being simplistic, but at the end, it's a vascular disease. Those cells that are feeding your organs are not letting the blood flow go through them because just like honey is sticky, that excess sugar sticks to those vessels. Just like cholesterol, fat, it sticks to those vessels. An analogy is like just throw some honey in your shirt and it's not going to come off that easily. And if you throw some fat or oil in your shirt, it's not going to come out so easily. The same thing when time goes by, your vessels get damaged. And if it happens to your brain, you already know, brain attacks, strokes. So it's important to remember that diabetes is a vascular disease and also that it takes time. It doesn't happen right away. And again, because of our genes, it doesn't happen to everyone. Not because you have diabetes, for sure you're going to have eye problems, kidney problems, amputations, but there is a risk for that. And as doctors, what we do is attempt to detect early those changes because we don't want you to have a heart attack or stroke, or we don't want you to lose your feet or your toe. We don't want to make sure you don't go blind, and we don't want the kidney to fail because that's going to create another set of problems. And of course, we treat diabetes because we don't want patients to have pain because of neuropathy. So at the end, I just wanted to reaffirm that point that diabetes at the end is a vascular disease. Because everybody's like, well, it affects the eye, no. The reason it affects the eye or the feet or the heart is because the vessels, the main source of not only nutrition, but also the main source of oxygen is being obstructed, not only with our diet, but because our metabolic disorder called diabetes is unfortunately affecting not only the sugars, but the fats. So you cannot control your cholesterol if you don't control first your sugars because they're intertwined. And that's my talk for today. Make sure you seek medical attention. Don't let diabetes take your life just because you want to delay treatment. It's important for you to get treatment. Thank you for watching.